Thank you everybody for being so supportive. It really helped.
The Kiwanis mission is to serve the children of the world. Our vision is to provide support for the fellowship training and research at BC Children's Hospital and to directly benefit the well-being of children with emphasis on research related to childhood cancers.
In British Columbia, about 4 to 5 classrooms of children every year are afflicted with cancer. And in fact, it's the second most common cause of death in children after accidents in the over 1 year of age group. So it's still a significant health problem.
Abiette had bone marrow biopsies taken too, which would be through her hip to the fluid around her spine. And she had all her treatment, her chemotherapy, and most of that happens here in the clinic with the doctors here. And then the major one was her bone marrow transplant, where they wiped her immunity out to absolutely nothing and gave her cord blood for a new immunity to be built. Lots of trouble with her breathing. She had to go to the intensive care unit, and that was a very scary time for me because I didn't really know what was going on, which was very, very scary, and I had to leave whilst they performed a bronchoscopy.
He was just an ordinary boy, right? He was diagnosed at, age 6, just before his 7th birthday. So he went from a life of playing soccer and doing all the ordinary kid things to all of a sudden being introduced to this whole cancer world and BC Children's Hospital, and at that point, life was quite different.
With the new hospital that's being built, we are hoping to expand our program and increase the number of fellows that we can bring into our training program, and increase the visibility of our program and the strength of our program so that we can recruit excellent physicians from around the world and train them. So I think that's a huge potential benefit, not only for the children of BC, but also for the training that we can provide for future physicians.
All of the shock and horror, the baggage that comes with a cancer diagnosis and a critically ill child, is horrifying for parents, but for the kid, it's just, well, okay, that's yesterday's news, and what are we going to do for fun today?
Spencer and I like to play video games, play outside, and yeah. We'd watch movies and, yeah, just hang out in the hospital. Well, I think we're brave because we fought through all of this, and then, yeah, so.
You don't know how much you are contributing to children with cancer by helping fund and train new doctors. These are people are our future. They're the future for the children. These are the doctors that are going to lead the way, and they're going to be the future for the children. The people that we train, what we call fellows, are the doctors that we're training to become the new oncologists in the future who can both work on new cures, new understanding, improving the treatments.
Okay, and one more big deep breath. As a senior fellow, so I'm in the last year of my training in order to become a fully trained pediatric hematologist and oncologist, and I've spent the majority of my training here at BC Children's Hospital. I did my residency in pediatrics, and I'm just finishing my 3-year fellowship here in hematology and oncology. I believed when I started this program this would give me the best training I would need in order to succeed in the future as a pediatric hematologist and oncologist.
Whilst I was sitting in the waiting room, not really knowing what was going on, Jacob phoned home and informed my husband what was going on. So at one point he came back and just stuck his head round the door and said, "Not to worry, she's doing really well, and I've told Alex and he knows what's going on too." So that was an immense help to know that they were there to help.
So we have some trainees from literally all over the world. We've had trainees from South Africa, from New Zealand, from England, from Pakistan, from India, from Jamaica. And so graduates of our program are treating children with cancer literally all over the world, and that's something that we're really proud of.
I'm actually German, so I came a year and a half ago to Vancouver, Canada, and I did all my training, my medical training and my pediatrics training in Germany. I've done some research before, and I was really interested in how I can combine my clinical work with a clear research interest. And BC Children's is just an amazing place to be at, especially with the combination of Child and Family Research Institute and having the possibility to do leukemia research in a really wonderful and very well-known institution as CFRI in conjunction with my clinical education at BC Children's Hospital. So for me, I looked around and was pretty clear that I wanted to come here.
We need more of what we call clinician scientists. In other words, doctors like myself who take care of patients and do the research. And we need to train more of those clinician scientists in Canada to help the children in Canada.
They're excellent candidates. They've got great potential to do wonderful things in terms of the world of pediatric hematology oncology, but we just don't have sufficient funds to take them on as trainees. And you know, that's a bit of a tragedy really, because you know, these young physicians are willing, they're excited, they're enthusiastic about pursuing a career in pediatric hematology oncology, and there's certainly a need out there for these highly trained individuals. And it's a real pity when we have to turn talented people away because we don't have the funding to support them. So that's, I think, our biggest challenge.
When I was in ICU, I sort of felt a bit sleepy, and then sometimes I felt like I was on another planet.
And ICU was incredibly scary and intense, and we were very glad to get back to our ward, weren't we?
Yeah.
There's nothing left. We'll save the day.
The Kiwanis Pacific Northwest District has set a goal of $500,000 amongst the 3 fellowship training hospitals in our district, Dornbecker, Seattle, and BC Children's Hospital. With 10,000 adult members, that's only $50 per member. Please support this worthy program so that we can make a difference in children's lives, and we will help find a cure for childhood cancer.
I don't know what, being heroic or courageous is, and we used to hear those words a lot. But really, it's just about, you gotta get up every day and face life and what you're doing, and the question is, how do you want to do it? I think, lots of people would be exactly the same way if given the same set of circumstances.
Sure they would. I'm sure they would. There's a lot of heroes out there.